introduction to the Gateway to get us started. Some of our regular attendees will recognize this video, but it really kind of plainly puts out the reasons why we established the Health Data Research Innovation Gateway for those of you that are newer to it.
At Health Data Research UK, we passionately believe that health data innovation has the power to change the world, now more so than ever. However, finding high-quality health data for innovation is complex and difficult. Data is spread out and fragmented, held separately by thousands of organizations. And as health data is highly sensitive, ensuring safe and secure access to guard against misuse can be a time-consuming process. The whole system can appear opaque to outsiders, and people are rightly interested in what's happening to their health data. This lack of clarity is stifling innovation, and we at Health Data Research UK want to challenge this status quo. We want innovators and researchers to be able to easily discover health data resources that are so vital for their research. So, alongside our partners, with support from our funders and help from patient and public representatives, we are building a UK-wide network that helps innovators get safe and efficient access to a huge array of health data and resources. To lead this, we created the Innovation Gateway. This technology platform brings together the information that explains what datasets are available, what they are used for, how they are structured, linked, and accessed, and provides tools to analyze them. It facilitates discovery, shortens access times, and promotes analysis in safe and secure environments. All this through a transparent system that has been built with input from patients and the public. The Innovation Gateway frees up time for innovators and researchers, enabling them to concentrate on analyzing health data to create life-changing solutions. Like finding more precise cancer treatments, understanding the spread of COVID-19, or even exploring why patients respond differently to different treatments. We're just at the start of our journey. But together, we can ensure better research and health outcomes for generations to come.
Great, so just to give a bit more background on from the video. So the Gateway launched in 2020 as part of Health Data Research UK to tackle the issues we saw for researchers and beyond in the health data landscape, where, as the video mentions, it's difficult to discover what health data sets exist in the UK. So researchers often kind of checking multiple places to find this information, what these data sets contain, i.e. whether they would be of use to your research, and then also difficult to discover how to apply for access to these data sets or who to apply for access to. So the Gateway is really aiming to become the common kind of entry point to solve this. I'm not going to go through how the Gateway works in detail in this session. We've covered it before, and I would encourage you to go explore the Gateway if you haven't yet. But in a nutshell, we have over 660 health data sets listed on the Gateway on behalf of data custodians, as well as other health data resources such as projects, tools, and publications. So the Gateway has a search function and filters to help you discover data sets and these other resources, and then information about those data sets. So the important distinction here is that the Gateway doesn't hold or store data, but the dataset listings help you understand whether a dataset could be of use to your research by providing kind of detailed metadata. And then each dataset has a request access button, which connects you up with the data custodian responsible for that dataset and our data access process. So what we're going to be talking about today is actually what happens post-Gateway. So you've discovered datasets on the Gateway, you've gone through the data access request process facilitated by the Gateway, And now the data custodian is ready to grant you secure access to the data set. And they might do this through a trusted research environment. So I'm now going to hand over to Sushil Varma, who's our Director of Engineering, who's going to give a bit more of an introduction on what trusted research environments are and HDR's involvement in this.
Thanks, Vicky. Good morning, everyone. My name is Sushil, and I will be talking to you about trusted research environments and what role that plays within the health data ecosystem. Some of you may be researchers or citizen scientists who requested access for data. So as Vicky mentioned, you've discovered the data set or data resource that you want to run your research on. You also have gone through the process of submitting your data access request. What a trusted research environment is also been called a data safe haven, is a secure computing environment within which you're given access to the data in a safe and secure manner, where you're able to conduct your research and collaborate with other teams or researchers to facilitate your research. And the idea of that is to build a perimeter around the data, so you're protected not only from malicious people outside, but also within the organization as well. So you're able to access the data securely, you're able to run your analysis and produce outputs that is of benefit to public and patients. Why is it important to provide a trusted research environment or a safe environment for computing? One, it makes research safer. It makes sure that public and patient privacy is protected and confidentiality is protected throughout the entire process, end to end. It also makes it more efficient and collaborative and cost effective. If you remember the old days of where data sets were released to researchers, centralizing some of this activity allows collaborative efforts between researchers where people can build on other researchers' ideas, but also becomes cost effective to manage how data access requests and research is computed within a single environment. And having it in one place allows you to bring in other reference data sets that you might want to combine within a trusted research environment to allow you to facilitate your research. I won't go into detail about the 5 safes because I know Sarah will be talking about the 5 safes, but fundamentally the trusted research environment is focused on 5 aspects: safe people, so who you are and being able to give authorization to access the data for yourself and your team, what project you're trying to do, what is the kind of analysis you would like to perform on the data, where would you like to perform this analysis, so what are the security measurements within the trusted research environment, what data you'll be accessing, how minimized is that data set, and how linked do you want that data set to be. All of these are metrics that are taken into account before access is granted, and these are security perimeters that is placed around the data and your environment to make sure you have a safe and secure and productive experience within that environment. And finally, safe efforts to make sure that the outputs that you generate are statistically verified to make sure there is no re-identifiability risk for the data you produce out from that environment. Next slide. So a trusted research environment, as I mentioned before, it essentially fundamentally provides those 4-5 capabilities within the environment. Here I've highlighted 4. And the idea here is we're trying to build a set of capabilities that is common to every TRE that's available across the UK-wide network. There are many TREs, some that have jurisdictional coverage, some that have data modality coverage, so genomic data sets, as opposed to imaging and electronic health record data sets. So there are different dimensions as to how data sets are distributed within trusted research environments. And the common features that each of them have are described here in these slides. The first bit, which is around safe people, allowing researchers to sign into an environment and access services, being able to run your analytics within those environments and be able to distribute your analysis across multiple environments in case you want to combine multiple data sets, being able to discover and access metadata and data from various different environments and combine them in a seamless and secure manner, And there are often you will not be able to perform all of your computes, all of your research ambitions within a single trusted research environment. So you're able to burst out into other environments. For example, if you want to use a particular GPU computing or a bioinformatics code processor, you're able to access those services from other TREs to be able to run your analysis there and come back down into your TREs to continue your research. So this is a set of capabilities that we would like to standardize so that you have a seamless experience across many TREs. And Sarah will tell you about the experience within ONS, which is one example of this instantiation of these capabilities. Next slide. And this is the reality of our landscape today. There are many different types of TREs, all the way from a single TRE run by an institution that provides access to a limited set of researchers, all the way to a large data custodian that has a TRE that runs fully in a public cloud or a private cloud with the security perimeters in place. And what we're trying to build is, there is no one TRE. There will be many TREs, and what we're trying to focus on is the interoperability across the different levels of the TRE, providing guidance, best practices, standards, so suitable software and principles and requirements to allow researchers and TRE providers to move across those levels based on the research ambitions and the type of data that's being used. So this is our direction of travel. In terms of where we are in the health data ecosystem, we convene trusted research environment providers, data custodians, and researchers to gather their requirements, bringing in public and patient advisory groups to make sure the security and privacy and confidentiality of that data is paramount throughout the entire process of delivering high quality research for public and patient benefit. With that, I'll hand over to Sarah, who will tell us more about her experience and of delivering a TRE within the ONS.
Hi, thank you so much for that, and thanks for handing over. So yeah, my name's Sarah Fisher. I'm currently working as a business change manager within ONS for the SRS, and also within the area for the IDP or the IDS, as some of you may have heard. So I've come here today to speak about the SRS and basically work and explain how we operate, what we do. And I know I have seen the question pop up about how people become accredited. So I'll also be speaking about that as well. So I know that we have already briefly touched on the 5 SAFEs framework. So this is basically the bread and butter. This is what we base the SRS on. So as you can see here, safe people, safe projects, safe settings, safe outputs, and also safe data. And this is what builds the SRS essentially. And this is what kind of gives that guarantee and gives that assurance to data owners. So data owners, data suppliers, that we can hold their data safely and securely, and for it to be used in a safe and secure environment. Next slide, please. Brilliant, thank you. So as you can see here, it's probably a little bit small, but this is the researcher journey. So from the initial application, either through the HDR portal or through our own application service, which is called the Research Accreditation Service. This shows a really high level from start to finish how people can actually gain access to the SRS. And I will go into a lot more detail about each of those 5 SAFEs models there. Now, as it was mentioned as well about the people being accredited, everyone who accesses the SRS must be an accredited researcher. And my best analogy that I would explain that with is essentially, once you're accredited, that is your driving license. So once you have that driving license, you can drive as many cars, or you can work on as many projects as you want in the SRS environment, subject to insurance or subject to accreditation of that project, so approval of that project. Now, to gain accreditation, what will happen is you must supply and you must apply for accreditation through either the Research Accreditation Service, and you must attend training and complete and pass an assessment. Now, subject to that all being passed, you would then successfully become an accredited researcher. Now, that's when we start looking then into the project application side of things. And what will happen is that you can then request a project application, either again through our own individual service, or again through the HDR portal. And we will need to make sure that we do have all of the right permissions in place from a data owner perspective, and also to make sure as well that the right legal gateways are in place. Next slide, please. Thank you. So I'm just going to touch a bit more in a bit more detail about each of the 5 safes here. So as you can see here, I briefly mentioned it earlier in regards to safe people. So this is the actual accreditation, and the way that we have that assurance around safe people is by ensuring that basically we ask for, first of all, that we have that assessment. So we ask for the proof of experience. So it needs to be either 3 years experience using microdata and research, or alternatively for them for individuals to have either a 2-1 or a 2-2 with a degree with a significant amount of mathematical and statistical components. And based on that experience and based on that evidence, we're able then to make a review and make an assessment on those researchers. Once we have reviewed that, we will then, and it is a requirement that people then attend training. And this isn't just training in terms of kind of how to do the analysis, it's also training in terms of how to use the service, how to use the system, what to do, what not to do, and also gives a bit more information around the statistical disclosure control. And I will touch on that very shortly as well. It makes sure as well that we have around the administrative processes to, again, make sure that we're in line with other data protection laws and things. We are making sure that we are looking after people's information, making sure that their personal data is always up to date, making sure that we're not kind of sending things to the wrong people, and also making sure people are who they say they are when accessing that data. Next slide, please. So safe projects, this is in regards to, as I said, actually accessing the SRS and actually doing and conducting that research. So projects within the SRS must be legal, and there are 2 main kind of legal gateways that we use for accessing to the SRS, and those are the Statistical Research Service Act, so the SRSA, and also the Digital Economy Act. So projects, once submitted through the HDR portal, they do go through quite a few checks and quite a bit of scrutiny to ensure that all of the information that is being provided, such as the methodology, the purpose, all of that kind of thing is legal and it is ethical as well. So that is to make sure that the research that is being conducted does have a public benefit. It does have a public good, and it also makes sure as well that where people aren't going to be accessing data just for, you know, commercial use, for example. So it is actually going to have an impact. As I said, in terms of that feasibility assessment, that is to make sure, as I said, that there is a clear scope, there is a clear purpose, there is a clear reason that access is being given. And also we do ask for examples as to why people need access to the data and they can't use publicly available data. So again, making sure and giving that assurance to people that the data that we hold is only being accessed and given to people who actually need that for the right research purposes. And finally, the last thing as well is in regards to the ethical side of things. So all projects do need to be ethical. We do ask for evidence of an ethical consideration, either from people's organisations or from their academia, or alternatively, there is a self-assessment form that we do ask for people to complete. And that's just a lot easier way for people to kind of complete that, and we can then make that assessment. Next slide, please. Thank you very much. So going on to the safe settings, so in regards to the SRS, there are a number of different ways that people can access the SRS. And the way that this is excuse me, either through a safe setting, or we can do something now called an AOC as well. And I'll go into a bit more detail about accessing the SRS in a second. But the safe setting, this is all in regards to assuring data owners as well that we do have the correct controls in place to make sure, again, that the data isn't being mishandled or mistreated. So within the SRS, we do have technology systems in place where we do actually have real-time click live streams to ensure that we can actually work and see if people are kind of misbehaving or doing something with the data that they shouldn't be. Once you are in the SRS, there is no internet connectivity whatsoever, and it also has data restrictions as well on data recording methods as well. So, you can't screen share, for example, within the SRS, and within actually in a safe setting, we do not allow phones or smartphones or notepads as well, again, to give that assurance that the data will not be coming out of that environment. We have physical security around our safe settings. So we have CCTV monitoring in both the safe settings and also the safe pods, which I know that someone has also mentioned, and we do make the SRS available within those safe pods as well. And again, the security and procedures and protocols. So we do have regular audits. We do ensure that there are paperwork as well and that is signed, so people are aware of the kind of implications of the SRS and what they do need to adhere to, with clear breaches policies and procedures as well. Next slide, please. Thank you. So as I said, in regards to accessing the SRS, there are different ways that this can be done. So the first one is the one that a lot of people know about already, is a safe room at the ONS site. So across London, Titchfield, and also Newport, South Wales, we do have safe settings within all of the offices, which allow people to actually access the SRS from a safe pod. And again, that's where the kind of CCTV and things come into play. Recently, in the last couple of years, we have also introduced something called an AOC, which stands for an Assured Organisational Connectivity. And what that is that allows individuals now to actually access the SRS, so the Secure Research Service, from an approved site within their government department. So that might be, for example, other government departments have safe settings for us, so they can book into other safe settings, such as the University of Manchester have one. Or it might be that another organisation would like to introduce a safe setting as well to their organisation. And finally, we also have as well other government departments that, again, if they can meet the right criteria and the right technology criteria and the right security procedures that we need, they can also access, again, from those government departments. But those criteria is such as, need a card swipe to actually access the office, for example, or they need to be able to sign in and that kind of thing. Now, as a result of the pandemic, a lot of people couldn't go into the office, as you can imagine. So we were kind of stuck in a situation, unfortunately, where we needed to work out how people could still continue their research. And also, especially as a result to the pandemic and as a response to the pandemic, how could we make sure that research wasn't then delayed? So as a temporary measure last year, we did introduce something called home access extensions to AOC. And what that meant is that for organisations who already had that assured organisational connectivity agreement with us, we then were able to introduce, alongside with our legal services, a home access to researchers. Now, again, a lot of work went into that to ensure that the security around that was safe, that data was handled correctly. And luckily it has, what's quite exciting is that we are exploring now home working as a permanent option. So we're working not only with the UK Stats Authority, but also working with legal services and also the National Statistician to ensure that the security arrangements are in place and make it more permanent for research to continue from home. Next slide, please. Thank you. So safe data. So this is all in regards to the data that we hold within the SRS. So you've got access now, you've gone into your safe setting and you go into your project and you want to start using the data. So when you are applying for the data, there are all sorts of different data sets that we do hold within the SRS. So obviously we hold ONS data, which is the first one that we kind of ever introduced. And then we've started to get more data from other government departments as well. Also, under the Digital Economy Act, we are able to use those powers and get more data from other government sectors and also commercial and voluntary sector companies. And as the exposure to the SRS has increased, as has our data catalogue, which is quite exciting. So it does allow for more people to have access to data and secure and sensitive data for research purposes. Next slide, please. Thank you. So this is just a bit of a snapshot of all the different types of the data that we have currently hold within the SRS. As you can see from the ONS side of things, we have things such as the census, which I know that quite a lot of people are looking forward to getting the 2021 one. We have the business structure database. We have births and mortality data, which is very closely linked with the HDR. I know that that's something that is currently used. And also as well, obviously the COVID infection survey, which has been understandably a big hit recently. From other government departments and public bodies, we've recently introduced and been able to obtain the longitudinal education outcomes, which is a massive, massive bonus and a real positive for the SRS. It's something we have been working on quite closely with the Department for Education for, so to get that in is fantastic. We do work quite closely, as I said, with other government departments, such as the Department for Transport, BEIS, and the Ministry of Justice as well. Currently, as it stands at the moment, we do have just over 120 different types of data available in different data sets. And that is a mix, as I said, between ONS and government department and public bodies data. The ratio at the moment that stands with at the moment is about 65 to 35. But the increase for government department data recently has increased significantly, and that has also been as a result of the ADR UK investment funding, and also as well just the exposure that we have had recently as a result of the pandemic. Next slide, please. Thank you. So you've gone into the SRS, and now you've decided that you're going to do some research on the COVID infection survey. You found out some really interesting information, and now you want to publish it. You want to show people all of the great work that you've done. How do you do that? Because we've got the security measures in place. You can't take anything out of the SRS. Once you're in, you can't access the internet. So what do you do? So what we do now for the SRS is we have something called safe outputs. Now, there are two levels of safe outputs. We have something called a publication output, and we also have a pre-publication output. And outputs are non-disclosive data, non-disclosive documents, files, spreadsheets, or presentations that allow for people to then publish their results. Now, these outputs are scrutinised by the team, the statistical support team, and they go through two types of checks. And those checks are the statistical disclosure control check, sorry. Now, we work on a principle base. So what that means is our kind of threshold, our normal threshold at the moment is a number of 10. So basically what we kind of take is anything below 10, we do seem to feel that is disclosive. However, as we are principle based, we are happy to have those conversations with our researchers and also discuss, for them to explain why potentially it isn't disclosive. We ask for people throughout the application process to clearly specify how the outputs will be published. So will those be in journals? Will be on a website? Will it be just in a paper or a new book? Things like that. And as I said, and as it says on the slide as well, it does require a lot of collaboration with researchers. We don't have barriers, we don't want to have barriers, but we do need to make sure that that disclosivity is at the heart of what we do. Next slide, please. So the impact that we've had, so this is just a bit of a showcase of the impact and the work that the great work that has been carrying on within the SRS. So if you can go to the next slide, thank you. So from here you can see the COVID infection survey. We've worked really closely with the University of Oxford and also colleagues at ONS to create the and to do some analysis on the COVID infection survey. So the COVID infection survey was introduced as a result last year to the pandemic. And within a number of days, we had to create this environment and create this space for analysis to take place. So within a number of days to meet that urgent need, we were able to meet the demand, and people were able to then start the analysis within the SRS securely and safely. And as you can see here from a quote there from Seti and Diamond, we've been able to create a crucial piece to the jigsaw needed to create increase the understanding of the infection rates. So it's a real detriment to the team who have been able to provide that information and also that analysis as well. Next slide, please. Closely followed by the schools infection survey. Again, all of this analysis work has been done within the SRS. So the brilliant work that people have been doing has been influencing the number 10 in terms of their responses to the COVID infection rates and things like that. We have been, the research has been widely reported in the media, so BBC News, ITV News and things like that. And all of that great research has taken place within the SRS. And as you can see here, there has been no statistical difference found within the SRS between school staff data and the wider working age population. And again, that's all feeding in there to those brilliant work and results. And next slide, please. Thank you. And finally, just a few quotes there from people just in regards to the SRS and what their thoughts are really. So I think that kind of feedback is invaluable when it comes to service and also for the delivery. So it's really positive to hear that the work that we are doing is actually making a difference. Thank you very much, and happy to answer any questions.
Thank you so much, Sarah. That was really great. Really good to get an overview of the SRS. I think Sushil has been busily answering a lot of questions in the chat, so thanks for that, Sushil. I've got one for you now, actually, that I don't think Sushil got to. So someone asked, how do you manage applications from researchers based outside of the UK? Do they still have to attend training, and is this virtual?
Yeah, so access to the SRS is only currently accessible within the UK. So for people who are requesting access to the SRS outside of the UK, their project does have to be sponsored by a UK governing body, or it does have to be a UK-based sponsor. So for example, if somebody was based overseas, but they were part of a university, that would be fine for them to apply, but they would still need to attend that training